Hi, Cora. How are you? Congratulations so much on your new baby. How has the first week been for you? I know sometimes it can be really hard. I know getting used to sleep and sleep deprivation and just adjusting to feeding schedules. I know it can be just really overwhelming. Do you feel like you have some good help at home and people in your life? Yeah? Okay, great. Well, just remember, if you ever need anything, you just can always call me or text me. It's either way, it's fine. Any time of the day or night. Um, we're here. I'm here to check on you and your baby and see how you guys are doing these first few days at home. We're going to talk about your baby's health, feeding, sleep patterns, just overall well-being, and I'll be able to answer any questions you have, any concerns. So how is feeding going so far? Are you breastfeeding or formula feeding? Breastfeeding? Okay. Awesome. How are your breasts feeling? Do you have any pain when they're suckling? How are your nipples doing? Are there any spots that feel hot or warm? Do you have any pain or discomfort? No? Or yes? Or okay, great. How often is the baby feeding? Oh, every like 2 to 3 hours. That is perfect. That's exactly what we want. How long does it usually last? Sometimes 30, 40 minutes and sometimes 10 minutes. Nah, I feel like that's pretty normal. Do you notice that on the shorter feeds, they want to feed more often? Yeah, that's totally fine. Just know that that's just part of them growing and learning, and their mouth is learning, their belly's learning, their digestive system's learning, and so they just gotta figure it all out. But that just sounds like a really great thing to me, great patterns. Are you having any issues with latch or anything like that? Now everything seems to be good. Do you mind if I watch you nurse at some point in our visit? Okay, great. That way, just if there's anything we're missing, I'll be able to catch it, and then you won't have to worry about it later. Awesome. Okay. How often is the baby pooping and peeing? Almost after every feed? Well, that tells me lots of good things. I'm really excited for you. But just know, as long as baby is having at least 3 to 5 diapers a day, we are happy. And at least 3 to 5 stools as well. Probably at this point, more wet ones. More like 6 or 7, but somewhere in that realm. As long as they're going every single day and going multiple times a day, that's awesome. What does the stool look like? Oh, it's finally not the icky black stuff anymore. It's hot orange. Awesome. And it has like little seeds in it. Perfect. That tells us that you have great fat content in your milk and that it's actually breast milk poop and no more meconium. So that's awesome. Have you noticed anything weird in the stool? Anything that would be concerning? No? Okay, awesome. How often is your baby sleeping? Kind of all the time. I know. That's totally normal. Do they have any wake windows? Oh yeah, about half hour in the evening. Yep, perfect. They wake to eat and then sleep and then have that little alert time. Awesome. That's exactly what we want at this time or at this stage in their development. That is so great. Um, just remember to practice safe sleep. So we always kind of just chat about that. Try not to have too many blankets, or if you're really really tired, try not to let the baby fall asleep on you, just for your own safety, and just for the baby as well, and so you don't have to worry about the baby. Have you noticed any signs of jaundice in your baby? So we're looking for any yellowness in the whites of their eyes, or if you depress their skin and lift it up, is it kind of yellow underneath? No? Do you mind if I take a look? Okay, great. I'll just look at it real quick and just double check and make sure. Does your baby seem like it's crying a lot or really fussy often? Just when it's ready to eat or dirty? That's pretty typical. That's awesome. What about your baby's skin? Have you noticed anything that concerns you? Any rashes? Anything that, like any extra peeling? Any raw spots? Just a little bit of baby acne on the face. Yeah, that happens, and it's just from them going from intrauterine to extrauterine, and their skin's just gotta kind of figure out what it's doing with itself. So as long as it doesn't get worse or look painful or the baby doesn't seem bothered by it, we'll just kind of watch and wait and see what happens. Okay. Let's see. Let's do a little exam on this little baby. Looking for alertness. Baby looks great. Great color, nice and pink. There's no blue extremities or no blue down the center, which is perfect. Baby is tracking, which is awesome, and it seems to like track when you speak. That's amazing. Temperature looks great, right at 98.1. And heart rate is right at 132. Perfect. Respiratory rate, baby's sitting right at 42. So everything is just perfect. Your baby is just doing amazing, and that tells me you're doing amazing. So way to go. Keep it up. And we're going to inspect the baby's head. We're going to just make sure that there's not anything extra like concerning. I'll just look at the fontanelles to make sure that there's no sense of dehydration, and just make sure that everything's kind of just symmetrical and is going back to how it needs to go. And I know we checked your baby's mouth at birth, but let's just double check it. So we're going to check the posterior tongue to make sure that there's no posterior tongue ties, the immediate, like close frenulum, the frenulum at the top of the lip, and then just what the dome of the mouth feels like. We already talked about the skin. We already assessed that baby has one birthmark right on its right hip at birth, and it still has it, so we know that that's probably going to be there for a while. And we don't see any sort of bruising or anything like that. The umbilical cord looks like it's about to fall off, which is perfect. It's nice and dry. Probably will happen within the next day or two. Don't worry about it. If it seems kind of icky and gunky around it, just do like soft cleaning. Other than that, looks great. Baby's lungs sound amazing. They're clear bilaterally, has great respirations, like as we already, established. Oh my gosh, my words. The abdomen still feels great. There's no lumps, bumps, or holes anywhere, so we know that there's nothing to be concerned with there. And then we'll just recheck the genitals. For this little girl, all of her little swelling's gone down. Everything looks perfect. And then we'll just check for range of motion in legs and arms, neck and head, and just kind of reassess the spine and just some of the reflexes. And baby's doing great. I mean, you are doing amazing. Baby's doing amazing. So way to go. I'm really proud of you. I'm going to leave you some handouts just so you have them in case you need them on feeding tips, breastfeeding tips, things to watch out for if something were to bother you. Umbilical cord care, I'm not going to really worry about it because the umbilical cord is literally about to fall off, so we're not going to worry about that. Diapering, we've kind of talked about a little bit. Just make sure baby gets really nice and dry after you're done cleaning the baby. Make sure you get into all the little folds, nooks, and crannies. And with little girls, make sure to wipe from front to back. And just make sure and just watch for signs of illness. So take the baby's temperature probably, once a day or randomly. Make sure that they don't have a fever, anything above 100.4, or that they're not lethargic, or that their breathing isn't heavy, or anything that seems overly concerning. But what about you? How are you feeling? Are you sleeping well? How's your perineal pain? Anything of concern there? How's your bleeding? It's lightening up? That's perfect. I love to hear that. Remember, you need to take care of yourself. Let me get your vitals. Oh, you're looking great. You're 98/62. Your pulse is like 87. Oh my gosh, amazing. No sign of fever. 97.9. That's perfect. Your uterus feels like it's still nice and firm and low. But if you have any pain, any issues, bleeding picks up, anything like that, just let me know. Just give me a call, okay? Do you have anything that you want to tell me? Is there anything you're concerned over? No? Okay. Well, I mean, everybody looks really, really good. Baby looks good. You look good. And we're going to set up your next appointment, and we'll see you in 1 week. Sound great? Okay, awesome. We'll see you soon.